everybody, I'm Susan Collini and welcome to our Renaissance Center and Collini Laser Clinic Roundtable. So,
Hi everyone. Hello.
hi everyone. Let me introduce first Ronnie on my right, your left probably. And Ronnie is one of our medical assistants in our operating room in our office. Then we have Derek. Derek is our director of the laser clinic. We have myself. I'm the administrator. I'm Susan Collini. This is Karen Turi. She is one of our cosmetic nurses. We have Marley. Marley is our new PA, our physician assistant, our physical assistant, our physician assistant. And then, of course, we have our Ashley in the front, who is one of our estheticians. So today, we are taking a little break from politics. So it gives everybody a little break to talk about what we're going to do for the holidays and feel good in the upcoming months ahead. So it's not too early to think about looking better for the holidays, because this is really about the time you need to do that. And one of the best quick fixes, as we know, are neuromodulators and fillers. So what's a neuromodulator? Quiz. Neuromodulators. They are products that actually, it relaxes the skin when you prevent the muscle from contracting. So of course Botox, Dysport, Xeomin, all those things fall into that category. So the quick fixes that I think are always those things and fillers. I mean, it's, you jump in, you don't have to think about surgery, it's quick, it's easy, no, very little downtime. You might get a little bruised, but I mean, there are some advantages. So I'm going to start actually with Ronnie, because Ronnie works a lot with Dr. Collini in the medical practice, and he's
always by his side when we're doing fillers.
That's right. That's right.
So yeah, I always help. I assist doctor when we're doing the fillers. It's it's an injection, so it's something that here in the office that we do. It'd be a regular appointment that you would come in for on a Tuesday or a Thursday. We'd have a nice consultation with you, go over what your best treatment is, and doctor will find that out for you, and then we'll do the injection. It's not bad at all. You're here probably in half hour, 45 minutes, so it's not bad. Wouldn't you agree?
Well,
I'm a subscriber. I wish I had stock in the market.
I just had mine done last week. I was probably in doctor's office for 30 minutes. He asked me some questions. He had me make some faces. And he just said, okay, these are your points, these are your wrinkle points, and I was good. And I feel fine, no bruising, no issues.
That's it. Karen?
Well, I think it's important that people, they should be going to a physician, hopefully a plastic surgeon, because you don't want to buy this over the counter, you don't want to buy it on market or on Amazon. You want to go to someplace where you know he's going to be good at what he does, he gives you the best.
Possibly she. Well, we were just discussing that some men think, oh, they don't need it, but Derek just got done telling me he can wrinkle just as good as any female.
It's all the same.
And that wasn't even a filler. That was simply Botox.
Just Botox.
And which is even a quicker treatment than is fillers. Botox just let's come in, quick injection, let's get you out, and that's your appointment.
And I think again, if you know your physician that's doing it, you have a good conversation with him. What lines bother you? Certain fillers, for those of us that are aging, that it doesn't give you a change in your appearance. It just lightens and softens the lines and wrinkles. So I'm with you. I think that's a great way to prep for the holidays without going too far.
I think I'm going to backtrack just a little bit, because we're assuming that our entire audience knows all about Botox and fillers. So who would be a candidate for Botox and fillers, or why would you want to do it? So, and how young do you start? These are all major questions that have come across my way over the years. And first of all, I think it begins with the person that you're starting to see a little grumpiness, a little tiredness, a little bit of facial change that you're used to. I think maybe we're all a little bit more aware because of all the social media and all the attention that it gets.
And all the filters.
That, yes, and or the non-filters.
Or the
'cause
non-
now,
well, when you don't
with
see
all
one.
you see every pore, every wrinkle, everything on camera very quickly.
HD.
Yeah,
Or
they-
the front camera of your phone.
the pixels are super observant. I think more so than I'd like to, me. But so the Botox. So what's the difference between Botox and filler? And I know if anybody's been watching our roundtables, we've talked about this in the past. So the difference is that Botox is this neuromodulator, so it is actually going to eradicate or soften a line because it's dynamic. It's a dynamic motion that is caused. So that means when you do those 11s and you try to squint I can't do it, although I'm starting to do it. I need some for the holidays. But when you try to make those 11s or you're trying to wrinkle your brow, those are all movements created by motion. So that's what we want to address first with Botox. And so that being said, we always try with Botox first because you'd be surprised at how much relaxation you get in the skin just by using Botox. So how do you know whether you need Botox or a filler for those lines? So the reason that young people start a little sooner than maybe we would have thought in my generation, we always thought we didn't have to do anything until we were 50 or 60, but actually your muscle has a memory, and that memory eventually that makes this line, it's not permanent in your skin yet, but as time goes on, that line will become permanent and is called a static line. So we never quite know whether it's static or dynamic in the beginning, so we always try to start with Botox if it's dynamic. Until something else, we're gonna come back to that, so we have a little bit of new buzz coming up that we want to talk about. But the reason that you would do that, you try to soften that line first, and most people get really nice results softened right away. If you see that you still have a line after Botox, I'm sure you'll notice that it's much softer, but if it's still there and bothering you, that's when you know that it's a static line. It's becoming a little bit more permanent in your skin. So that being said, that's when you would choose to have a filler. The other time that you'd choose to have a filler, and Derek and I were talking about this just before we started, is the way the face begins to age. And you actually start losing a little bit of fat in the face, and you start to go south in your cheeks, your jowling, that type of thing. So fillers can lift back up that area that is relaxing and fill those voids up in the face to get a more youthful look. And really your professional that you choose is going to know what's in your best interest. You could say, this is what bothers me, and have the professional discuss with you the different options that you can have. At that point, Karen, do you want to have anything else to say before I move around the circle?
Well, it was interesting that one of the best ways I've ever heard it explained was if you went to your mailbox the same way every day for a year or 2 or 3, you're going to have a little indentation, and that's where Botox would come in. Like if you just wrinkle once in a while, Botox will take the nerve and the muscle and disconnect them so you can't wrinkle. If you go to the mailbox the same way every day for 30 years, now you've got a pivot that Botox is not going to take care of.
Now you
and
need
that's when you
cement.
need your filler.
Now you need cement.
Now you need cement or your fillers. So, there's so many different kinds on the market. There's one that'll fit every person.
So Marley, being new to all this, what are your observations? What are your likes, dislikes? Actually, and you're so young too, so she's not quite a candidate. So she might have a different viewpoint than maybe those of us that are a little seasoned.
I would say to just, if you're not sure what you want, but like Susan said, you see some lines, there's some things that bother you, you can always come in for a consultation, and then, like we said, Dr. Collini is really good at examining you, and you tell him what bothers you, and then he can suggest if Botox or filler would be your best option. And you can come in for that consultation, and as we mentioned, that it's really quick to get the Botox or the filler. So you can come in not exactly knowing what you're gonna have done, and then Dr. Collini can make suggestions, and then we can do it all that same day. It's not like you have to come back and make another appointment. So I think that that's really nice, the quick turnaround that we have. And then another thing Karen and I were talking about is that Botox, I think a lot of people get nervous that it's going to completely change their expression, that they're not going to be able to, they're going to be like a mask face, like not be able to move or have expression. And Botox, it doesn't do that. You can still have expression, still look like yourself. It just helps to prevent those lines or remove them to some extent.
You know, and
Yeah.
sometimes the clinician is also the one that's gonna decide how much you should have, because you can keep putting it in so much that you can't move or you can't lift your eyebrows, and then that's where people get that frozen look
Yeah.
sometimes. So you need to have that discussion with your clinician on, you know, that's where we hear the baby Botox and the little things. It's really about the amount that's injected. Now we're talking about rejuvenation here with lines and fillers. So before I get to Ashley, I want to say that you can also use fillers for enhancement or to change a little bit of the face. The first thing being the lips, obviously, with fillers, and or maybe some of the facial structure, adding some cheekbones, or actually even putting filler in the nose. People straighten out their nose with some fillers. So there's some really different ways that filler is used as well to alter or change some of the facial structure. So Ashley, I'm going to let you chime in on this one because I know that you love lips.
I do. So I have a lot of experience with getting lip filler, and my favorite lip filler is Juvederm. Now there's so many different fillers out there. There are some people like myself who really like that super full, pouty, full look. Since Kylie Jenner and the Kardashians, whether you like them or not, they made them very popular, and actually a lot of girls between 18 and 30, I've noticed, are really into the lip fillers. And there's also, if you didn't like that extreme look, you can also do very subtle if you wanted to correct a little bit of lines around the mouth or on the lips. If you were kind of going through that more aging process in your life, there's some great ones. Vobella, Juvederm Vobella is a really good one because it's really subtle and you don't feel a lot of like poutiness with it, because I know I've experienced both Ultra and Vobella, and Vobella just gives you a really natural look. And my recommendation, if you're getting them for the first time, start off subtle, because you can always add, and you're gonna swell too most of the time. So when your swelling goes down, you can say, oh, like maybe I want a little more, or less, depending, but always start small and you can always build.
Very well said, Ashley. So now, as she just chimed in, there are all types of fillers and Botox and where to go what. The one really great thing I think that we do here is we really offer everything. So you will see 3 major companies out there, actually 4. Most people have heard of them. You've heard of Allergan. Allergan is the one that produces Botox, and they produce the Volbella, the Juvederm XC, the Velour XC, and the Voluma. That's all under Allergan. So there's a big umbrella there. Your next phase is, or next company is Galderma. Galderma is a Swiss company. It's very big in Europe, all over the world. It is where they produce the Perlane and the Restylane and the Dysport. So you'll see other products that come into their dermatological group, but those are the big ones that people recognize. The next one is Sanuva. That is the permanent one. Help me out here. No. Oh goodness. Belafil. So it's the Belafil. Belafil used to be Artifil, and that is the most long-lasting of all the fillers, and it's not a hyaluronic acid. So there are different things that some of these parts are made of. The other company that I also forgot to mention is the Radius company, that's MERS. So if you have Radius and you have the Xeomin. So those, and Bellatero is in that company as well. So you have a lot of different products to choose from. Now, I'm really going to blow your mind, because we have decided not only was that not enough for us to do, we have decided to do a little investment in a brand new European company. It's been around in Europe a long time, and it is called, I got the correct pronunciation now, it's called Revance. We kind of like Revance, because it sounds like Provence, and it sounds very, very European, very French, and I keep wanting to call it Revance, but it's Revance, and Revance, R-H-A, and so the reason that we decided to branch out a little bit into this company is that this is a filler meant for dynamic wrinkles. So this is a little bit different. When we talked with Karen, she talked about filling up that walking path with the cement. That's usually what we're trying to do with all of our regular hyaluronic acids or our Radius or other different products that we do. But this product, the reason that it appealed to me, and we want to try it with our customers, so we will be having specials going forward, but it is a more subtle approach to dynamic wrinkles. So let's just say that you have a dynamic wrinkle and you really don't need to fill it in with, it's just there as you're moving. But sometimes a little bit of filler will prevent you from actually moving if it's not in a place where you would have Botox. So in these areas, the lines in the mouth, you would not normally put Botox in those areas. So this is an alternative to some of our other big fillers. So I'm looking forward to seeing how this fits in to our practice. And the other big thing that I really liked, and I know Derek and I were talking about it yesterday, that it does not create a Tyndall effect. And so you might say, what's a Tyndall effect? And I don't know if anybody has had any filler experience, but sometimes there can be, if a filler is put in too shallow in the skin, there is a light reflection, and the way it's absorbed, you can actually get a little bit of a blue mark. So we really, if someone wants to have something in the teardrop troughs, so to speak, or somewhere where there is very thin skin, we have to be very careful about the way we inject fillers. So we really want to select something that doesn't create that Tyndall effect. I know that Derek had some other information on that and how it really works and why you kind of maybe want to stay away from that too. And also, I know you wanted to talk about other procedures that you may want to stay away from, and that.
So one of the things with the Tyndall effect, and something when we were doing our research on this new product, and what's really great about the Revance.
I love Revance. Why can't we call it Revance?
It has a very clean molecular structure. So when you say that, there's not a lot of additives to the hyaluronic acid. So they try to keep it pretty simple. And that allows for less refraction of that blue light, because really that's all it is when you get a Tyndalling effect, is just refraction of light. So when you have something that's cleaner, there's less refraction from that, and you have a better result from it. But the one thing that I'm always asked, because I'm the laser guy, everyone asks, is this going to, if I do a laser treatment, is it going to hurt my fillers, or is it going to hurt my Botox? There are no true scientific clinical studies that any of it actually goes into those structures and degrades them. The one thing that I tell most clients is you don't want to do it 2 weeks before or 2 weeks after we do our session. And it's not going to degrade it, it's just that your skin it will metabolize a lot faster because we're creating collagen, we're spurring new growth in the skin, and you just might see a higher turnover time with your Botox and your filler. With that being said, it's so important when we talk about dynamic and static lines. Sometimes when people do Botox and it does soften all of their lines, but they just have a little bit of a wrinkle left, we can go in with the laser and get that finite wrinkle out by smoothing the skin and help to build collagen. So honestly, I think that they completely enhance each other and that they should be used together, just with a little space.
Another little project I was researching when we were talking about the Tyndall, the blue light, when I was researching it, electronics have a blue light that is emitted through them. And my grandson this year, because he was virtual online all the time through education, his eyesight deteriorated dramatically. So that interested me, and I thought, well, if the eye can be affected, can the skin be? And yes, it can be. Too many electronics, too much selfies, too much electronics can actually harm the collagen in the skin and actually cause more wrinkles. Now, that being said, Derek and I and Ashley use blue light for acne, we use it for psoriasis, but that's in a controlled substance. So I just thought that was interesting, that we can degrade our collagen by being on electronics
phone.
too much.
Yeah, and the phone.
Well, that's
don't
why
even
we
know
want to
these
build it
studies are
back
gonna
up.
come.
We can do that.
So yeah, and one of the things before we move on from with lasers, if fillers aren't something that you're looking for, and this is a stepping stone before fillers.
This is your getting your toes wet.
This is getting your toes wet. So if you start to do things with lasers, you will see those lines soften and you will build collagen underneath them without doing the injectables if it's something that you want to do before you take that jump to going into Botox and fillers. And the other thing, we have a radio frequency microneedling that we have two different devices, Vivace and Infini. And what those allow to do is retraction of the needles to a lot of different steps in the skin so that we can actually get structure building in the lower parts of the face and in the jowls. And that was something that they had a hard time doing with just straight lasers before. So it can be a stepping stone or it can be used with Botox and fillers as well.
I mean, I think that that's really great for our viewers to hear, because I think many times they don't think about, you know, the timing of when they should do their services. And I think that's what we do the best here in our facility, because I think we have a solution
We
to
all work
every
together.
problem, and we do work together as a team, as I hope that you're getting to know that we do that. And so there are times, I mean, this morning I know I had a customer on the phone and I misinterpreted what she was really looking for, and Derek and I were both in the room together, so we're bouncing off with the customer and realizing what she really wanted, you know, after a little bit of discussion. So those are things that are really important amongst ourselves, and what you may want to do to get back to this getting ready for the holiday season and you haven't done anything before, or maybe you're a seasoned veteran, then, you know, you could teach us. But, you know, stepping in with a little Botox, a little filler is going to soften some of those lines that you might have or that you might be experiencing. Or if you just need a little bit of fun, and extra fun in your life, you want to get a little bit of a pouty lip, or you're not sure, but you can add that. You know, think about what Ashley's doing, and I just think that there are great options. As I said, I've been a subscriber for 27 years now, and I wish I had stock in the companies, because I just think they're awesome and they keep moving forward.
Something interesting, just because I always find what Doctor does very interesting, and I think that's another really important thing that we have here is his artistry as a plastic surgeon. I know that there are a lot of businesses popping up. I know there's a lot of places doing fillers. I think going to somebody with the experience and the medical background is very important. But another thing he takes on is he's reshaped the face. I know we talked a little bit about the structures, and the filler nose job I think is incredible. So helping people level out the bumps, he's done little bits of filler because he could go in and measure the face and figure out how to smooth out little subtleties like that for somebody who might not be prepared for a surgical nose job. It's just an easy way to go in and make a correction, and he's great at that.
And it makes people really happy too.
Yeah.
It's
Right.
right.
So
It's not
subtle
forever.
little things, and that's
It's
all
not
it takes.
forever.
Yeah,
It's
you could
something.
see what you might look
you don't
like
like
with
it,
that
If
structure.
you were on the fence about a surgical nose job, that's like a really good option to do, just to
Yes.
see what you'd look like
Mhm.
before you make the big jump.
And not everybody's a candidate, so you can't use every filler
No.
option for that. But if it's possible, you know,
Small
it might be
correction.
something that you would want to look into. But there are so many different things, and it's just such an interesting science that we get to deal with every day, because we get to help patients feel better about themselves, and they look better, and they really just go out and I think, you know, just live life to their best self.
Feeling
their best
fresh.
self. That's it.
When you look
Fresh
good, you
face
feel
forward.
good.
Exactly. I don't know if are there any questions in
There are not currently.
Oh, you know what, I know.
Everybody's busy. It's a little distracting
It's
today.
distracting today. We might be seen in hindsight. We'll be on the replay
But
button.
we will still answer any questions that anyone may pose.
Right, remember that you can always reach us through our website or through Facebook, or simple thing is just call our office. And the easiest number, because you can get us through Age of Innocence too, is 570-674-5555. That's an easy way to reach us, because that's Age of Innocence, and they'll direct you where you want to go. I think that's a...
And we have every first Tuesday and Thursday of the month, we do our Botox special.
Oh, yes, we didn't even talk about that, so I don't know if it's almost time to end. Sarah's flagging me down yet. Oh, she's giving me the go-ahead. I can speak for a minute. So we will be doing specials for the holidays. We routinely do specials every first week of the month. We do our Botox or our neuromodulators. We give 10% off of our customary fee that we normally charge by the unit, which is the recommended way in which to price Botox. The reason we do that, for a couple of reasons, so that you can get much more value for your dollar, and also so that you are guaranteed that you get some really fresh Botox. We're turning it around so quickly that you can always ensure that. The one thing that when you're not going to a clinician that's doing a lot of volume, you could have Botox sitting on the shelf forever, which really lends itself to being ineffective after a while. So we pride ourselves, that's the one reason we drive everybody into the first week of the month. It's not that we just choose that one arbitrarily. There are reasons why we do that. So you'll get that special on a routine basis, but we're gonna be coming up, and we are going to announce this because we have our, we're gonna do a virtual open house coming on November the 18th with Age of Innocence, and we'll feature things about the laser clinic and any services, other services that we provide. But at that date, that's National Botox Day, so we are going to be offering lots of specials that day through Allergan and fillers, so be watchful. Since we are going to be new to Revance, we will be offering specials because we think that it's a nice option and a nice new addition to our arsenal of choices that we have to enhance your looks. And so stay tuned for all those things. The other thing we do is we're very good at brilliant distinctions. Brilliant distinctions are the Allergan beauty points, and they're no longer calling them brilliant distinctions. So if you haven't heard this yet, they're called ALLE, A-L-L-E. Now, so your brilliant distinctions now are going to move into ALLE, so you'll be hearing that. But you do get bonus points by using Allergan.
For all over the place.
Yes, Allergan
Cool
gives
sculpting.
you points for cool sculpting, breast augmentation, Latisse, filler, the Juvederm, all those you get points, and then it turns into dollars. So those are all things that we provide for you and help you. Our cosmetic liaison, Sue, really works beautifully with our customers to make sure that they get every discount that they possibly can. And then to just backtrack again with what Derek and Karen had said before about choosing a trained clinician. Dr. Collini is in the face doing reconstruction when there's, accidents, fractures, facelifts, all those things. The knowledge of the way the structure of the skin should be and where fillers should be placed is critical. And why, I'm not quite sure why some people choose to go to their bargain basement clinician. I don't quite understand that. We've seen many people that said, oh my gosh, I got this done and got this done, how can you help me? Well, and sometimes all we have to say is, well, you'll just have to wait a little bit, but it will go away. I mean, that's the one thing, these
There's
things
another
aren't permanent.
point to that, that you brought up, Susan, was that some people will say, oh, I got Botox by the syringe and it was so much cheaper. You have to be aware that how they reconstitute it, they could be diluting it and you're not really getting the Botox that we offer you. So make sure you know what you're getting, pay per unit,
You get what you pay
and
for.
what you-
Cheaper
Ask
is
those
always
questions.
and ask the
better.
questions, right?
Right, because that's important. And,
Or just come here.
Or just
Yeah,
come here.
I think you'll love us. And,
We're a lot of fun.
that's it, we're a lot of fun, and we do great
And we
things.
love what we do.
And we love our patients, and we love our customers, and we try to do our very best for you, when you do come to us. And, I think I don't have much more to offer. How about you girls and boys?
Actually, there was one thing I almost forgot, the pain level. A lot of people are concerned with pain level with fillers. I could only speak on the lips because that's the only thing I've had done, but it's not painful at all. Doctor numbs you, and then he has such a good technique where I honestly don't even feel it. The most I feel is a slight pressure, like right around the cupid's bow, but honestly I didn't even flinch. So,
Yeah, and
very
typically, so if we're going into the nasolabial folds or the prejowl areas, doctor numbs you with lidocaine prior to the injection. So that's numb, you lay there.
We try to make our patients very comfortable.
Comfortable.
We have a lot of
as
ways.
possible.
Yes.
Yes, lots of ways, lots of ways.
You just can't go home and have a bottle of wine that night.
Nope.
You will just come.
It's swell.
That's-
I've been there.
So team, I guess this is a sign off, and we hopefully will see everybody at our open house, and stay safe until that time, and stay young and beautiful. We'll see you later. Bye now.
Bye.